Thank you for staying with us. Our focus now, the coronavirus. Ladies and gentlemen, viewers from far and near, COVID is very dangerous. It's as real as it comes. How do I know? Well, I got COVID very early into this year. I tested positive for a deadly cocktail of malaria, typhoid, and COVID-19. It was, as I am sure some of you can imagine, a terrible experience. My COVID-19 test result delayed a bit, but I finally realized I had all three at the same time, or that COVID had been masquerading as these other illnesses. How did this happen? I don't know. I had been, and I still am, observing the protocols and have been very cautious. All I know in the end is God saved me. I lost my sense of smell, saw my appetite take a severe beating. In fact, I'm still in the process of recovering it. Right now, I can only eat really well when I'm starving. If not, I really struggle with food. I suffered extreme fatigue, and even now I get a bit tired quicker than before, and so I've started working out a bit more to build up my stamina and resistance. It wasn't funny at all, believe you me. Some of you saw pictures of mine and said I'd lost so much weight. That's absolutely true. I'm still regaining that together with my appetite, and it's all been hectic, really hectic. I'm over it now, but the question is COVID over me? COVID is a nasty and unforgiving little monster. You don't want to risk catching it, believe you me. But you see, the more we talk about it and the more we know about it, the better we can fight it and the greater the strides we shall make against it. That's why this morning, we're sharing with you the real COVID-19 stories of Maria and Shadrach. Maria works with the University of Health and Allied Sciences. She's been a COVID task force member for that institution, which has been at the forefront of COVID-19 sensitization and testing in the Volta region. She's a COVID police, really, but she still contracted the dreaded COVID-19. For Shadrach, he's a pastor. He's been trying to maintain his flock, but something happened to him that changed his entire viewpoint. From our guests, however, I'd like to share with you something Maria has given us permission to share. Her thoughts and frame of mind a day after she got her positive test result for COVID-19. We'll be starting the conversation shortly, but do watch this.
Well, last night, lo and behold, the results came in, and I tested positive. And so this is my new reality. You know what really incensed me is the fact that I have been so obsessed with keeping to the protocols, believing that if I did my part and kept myself and my struggle safe by being responsible, that surely it would work. But guess what? Your efforts do not work in isolation. My efforts did not work in isolation, clearly. Because while you're doing your part, other people outside your bubble are working just as hard, as if the intent is to make sure that they take you down with them, because clearly they want to go down. It's a suicidal intent, and they must be wanting to take you along with them. And so they do everything in their power to flout the rules, to break the protocols, to vilify you.
So that is Maria Jura, and she'll be joining the conversation this morning. Let me also quickly mention that we'd like to hear from you watching us right now. What has your COVID experience been? Have you got COVID, survived it? What is your story? Do you know someone who has, someone close to you, family, friend? What is the story? Even if the person kicked the bucket, let's be open and let's talk about it. When we activate the phone lines, that number will be rolling on your screen, 0302 211 691 extension 2. You can call that number when the phone lines are activated and share your story with us this morning. But our guests this morning as we discourse on this matter. Maria Jura, she's actually Director of Public Affairs at the University of Health and Allied Sciences. We also have Dr. So let's just quickly get the name correct. Dr. Kwabena Duedu, head of the COVID-19 Testing Center, University of Health and Allied Sciences, and Dr. Eugene Dodoi, head of Psychological Medicine and Mental Health Department, School of Medicine, University of Health and Allied Sciences. Another survivor who will be sharing his story, Shadrach Opong. He is actually a pastor. Lady, gentlemen, a very good morning to you.
Good morning.
Great. So I'm sure I can hear everybody. If you've, I don't know whether everyone is, the sound is active, but if you've not unmuted, please do so. But Maria, I'll start with you. That clip we just showed, you appear to be upset, angry, even close to tears. What was going through your mind? This was just a day after you tested positive for COVID-19. What was running through your mind?
Ben, good morning. Good to see you on here. Yes, this, in fact, just watching the clip, my heart is racing a bit, as you can imagine. This was the morning after. So I had found out on the Wednesday, which was 2 days before at work, that I was a contact of someone that had, been confirmed to have it. And so that Thursday, I went and got tested. Fortunately, as you mentioned, working at UHAS and the testing lab just being a building or two away, this was done quickly. And so by evening, I got my report. Dr. Duedu called me himself, and I said, "How is it?" He said, And so that was the beginning of the conversation. And after he told me that I had tested positive, honestly, I don't know what I told him. And this may be a good opportunity to apologize to him if I inadvertently used some language which just came, because I don't really remember what I told him. But this is the issue. The next morning, at dawn, I went outside and recorded a message to myself. The whole night, needless to say, I did not sleep. And every time I assumed that I would close my eyes to attempt to sleep, I would wake up in what I now know was a panic attack, and be out of breath, run to the bathroom, splash water over my face, try to calm myself down, think about taking my blood pressure, and then deciding not to because I didn't want to see the elevated number and then get more agitated. And so this was my frame of mind that morning after not sleeping the whole night. It was particularly worrying for me because my 83-year-old mother lives with me. She's asthmatic. She is mostly immobile. She most of the time uses a wheelchair. And actually that whole week she had a really loud cough that she had been coughing. So this, the cough in and of itself was not that unusual because, like I said, she had, asthma. And the air quality in Ho at this time of year is not particularly good with all the bush burning and all of that. But my first thought was, oh my God, I'm about to kill my entire family. This was the thought that I've been stayed with and woke up in the morning with. And so you can imagine how agitated I was. This frame of mind not only sat with me that entire next morning, but I also had to then go to work and face my entire directorate and, have my staff, test and all of that. So we all did that. But this is the thing, is that for the next 5 days, this news I got on Thursday night, my mother got tested on Friday. We were waiting for the results for several days. And so that entire time, 5 days, where we were waiting to get my mother's results, I did not sleep. I would close my eyes to sleep, and then I would sit up in bed, as if from a nightmare. But I hadn't had a nightmare. I hadn't dreamt anything. I would just find myself awake and gasping for air and rush to the bathroom.
And Maria, let me just mention this. I just want to inquire of you, but before I do that, I've been hearing some sounds in the background. Pastor Shadrach Opong, I don't know whether it's from the television behind you, but you might want to silence it if it's not. Right, so whoever actually has something playing in the background, please actually mute it. Thank you very much. Maria, at this point in time, what do you feel was triggering these panic attacks? What were you afraid of? Death?
I was afraid of what was to come in the days ahead. Because as at that moment, I had not been officially told yet that I was asymptomatic. Of course, I know what the term means. And so I sort of assessed myself and said, oh, but I don't feel anything. I mean, honestly, I have not felt healthier than I do now. I mean, I exercise regularly, not vigorously, but it has become part of my lifestyle for many years now. I'm on all sorts of, immune boosters and medication, which I religiously take and all of that. And I eat very healthily. And I felt healthy. I mean, I didn't have anything approaching a sore throat, a cold, a headache, nothing. No malaria symptoms, no fevers, nothing like that. And so for me, there were several fears at play, which I have assessed going backwards and realized that this is what it was. The day on which I got the test and the results happened to be the birthday of my younger sister, who passed away 2 years ago after a short battle with breast cancer. And so you can imagine my mindset. If I were to think instinctively, oh my God, let me tell my mother so that we can protect ourselves. That was the worst day on which to tell her news like this. And so I didn't say anything. But then I started separating from her even more than I already do. I already practice safe distancing with her because I'm fully aware that I'm the only one who goes out in public and comes back home.
Right.
And so her welfare has been top priority for a year now. I don't go into her bedroom to even say, hi, I'm back from work, unless I've been to the bathroom, washed my face, washed my hands, any visible parts of my body, and then put on my mask, and then I go say hi to her. So I couldn't even do that. And then I couldn't explain to her why I wasn't coming near her. And my mother is not a quiet person. She will not take this quietly sitting down. And so she would call out to me, where are you? Why are you dodging me? What is going on? Is everything okay? And so I had to deal with all these, plus the knowledge that I was potentially going to break really horrible news to not just her, but my extended family. I mean, my sister, who also lives in Ho, has little children, and they regularly come over to visit grandma and to be babysat and to spend weekends with us and all of that. And so, of course, I immediately called my sister and said, this is what has happened. You should go get tested immediately. So she did that with her older kids. They went to the lab and did the test. Fortunately, they're all negative.
Okay, Maria, let's hold it right there. I'll come back to you to talk about how you feel about observing all the protocols and still getting COVID. But let me come to Pastor Shadrach Opong at this point in time. Shadrach, thank you once more for joining us. Now, What was your experience? You pastor a church. I mean, you go about your daily activities. Somehow you were observing the protocols, only to be hit, bam, man of God, you have COVID. How did you take it? How did you react?
Thanks for having me, Ben. Greetings to your viewers and kind of, okay. So for my case, I was going by normal duties. I think I remember there was one Saturday I had to travel to Tema area to officiate a funeral. And so we returned that evening, and my wife was complaining about headache and bitter mouth and weaknesses. So we decided that she should go and see a doctor. Maybe it could be a malaria or something like that. And so we did that. And she, after going through the malaria stuff, she was still experiencing those symptoms. And so we decided that she has to go and do the test so that in case there is something that we are not aware of, we can start early fighting it. And so she went to do the test on Monday, I think around getting to the part of January. And then she did a test on Monday. They said Wednesday she was going to have the result. And then it didn't come. So on Thursday, it came and it was positive. But I was already, I had already psyched myself that she could be positive and therefore she might have infected all of us. But she's a nurse. And so as a nurse, for me, it was going to be normal if she contracted COVID. And so she tested positive, and then we went to the Rage COVID center to meet the doctors there, and then they gave us the medication to start. In fact, what they said was that once she is a mother, she has been cooking for us, she has been doing all sorts of things for us, and she has it, the possibility that all of us will have it is high.
Right.
And therefore we should start the medication and then go and do the test. So we even started the medications before we did the test. And so on the Monday, we also did a test. I mean, myself and the kids.
So it was the doctors that suggested to you that you should start the medication even before testing?
Yes, for him, once she has tested positive and we are so close to her, it's highly possible that we all have it.
So tell us, just for the sake of time and to exhaust what we really want to do with this, in the end, what was the result for the family? For the rest of you?
Positive. And in fact, before the result came, the result delayed a little. I mean, it took about 9 days for us to get a result. But before the result, I couldn't sleep. I sleep at around 9, 10, and by 1, by 2, I'm up. As if somebody is telling you to wake up. And then by the time I'm up, my whole bed is wet. I mean, I have been sweating like something. And I didn't have much of the headache, temperature, and the coughing, no. But my kids were having temperature issues. And then my wife had already had those things. And so personally, my story, if you see me during the period, you would think that I didn't have anything because nothing was showing.
So you were kind of asymptomatic
and that's what
in a way.
I think a lot of people out there think that they need to see you, maybe, excuse my language, bleeding through your nose, and then maybe you are you cannot walk, you are on a stretcher, or maybe in a wheelchair, for them to believe that probably you have COVID. But it's not like that.
Right. Let me ask you, as a man of the cloth, having your family, your entire family hit by COVID, did it impact your faith in any way? Did you think, God, why me at any point?
Well, I think that is the time to even trust the Lord the most, because all things work together for good for those who love God. And let me tell you this, COVID probably might have helped me to impact more life than before, because I mean, you might have heard that I started writing about letters from COVID-19 prison. In fact, with my experience, let me add that after COVID, I had post-COVID complications. And so I had to be admitted at the ICU at Kolebu. I spent about 4 days there. It was terrible. I mean, I don't know whether it's permitted for me to share some of the pictures and videos I took at the center. But it's terrible. You see, no human being should get there. No human being should get there. But my experience there showed me how God is so merciful, so loving and caring, and how God, put us in situations for us to appreciate the provisions he does for us every single day. Because at a point in time, I started fighting my wife that she connived with my doctor to put me at the ICU because I was feeling fine. I was okay. But the doctors, they thought that, hey, you are dying, okay? You are having blood clots inside you. Your sugar is shooting up, and therefore you can collapse. And so being there and seeing people, I came to appreciate the fact that God said we should be obedient. You remember the Bible says that if you're obedient, you will live longer. Children, obey your parents, for this is the commandment, that you may live longer. Live longer has to do with obedience. And so I got to understand that people out there who have taken this thing to be a joke, to be a political, thing, and not obeying the various rules and protocols that have been put in place, are seriously infecting people.
Right. Let's hold it right there. Those who are taking this for a joke and not obeying the protocols, and that's a great worry. I'll be coming to Dr. Duedu shortly because he's head of a testing center at the University of Health and Allied Sciences. But before I do that, Maria, how did it make you feel, the fact that you were observing all the protocols? You are a member of the COVID-19 task force in the University of Health and Allied Sciences. You are like a COVID police on campus. You do everything, yet you still got COVID-19. Very briefly, how did that make you feel? Frustrated?
You know what? My initial feeling was I was very livid. I was so angry because I knew it, like they said, as Job said, the thing that I most feared, this is it. And this is exactly what I told my staff, that everything that we have been fighting to prevent, the reason why I am the way I am, and you people have given me a name behind my back, and people look at me sideways when they come in, and I throw them out and say, you cannot enter this office without them. This is the reason why. This is exactly what we're trying to prevent. And so, honestly, I was very, very, very annoyed because I knew that this is not on me. God forbid that my mother's results or my extended family's results or my house girl or anybody that has been near me should come in and turn out positive. God forbid. But should that happen, I know that it's not on me. this is not on me. I do not own this problem because I had done my part and I had been trying my best to educate people. I have made enemies all around Ho, in the shops, in the pharmacies. You go in, they have no masks on. How can a pharmacy be being run during a public health crisis period? And the pharmacists, trained pharmacists who have been to pharmacy school and know the kinds of medicines that people are coming to buy and what those medications do, they are not wearing masks. They have to see me coming with my tall, angry face, and then they'll scramble and put on their masks so that I don't yell at them. This is the trend, you know, and I always tell people that you are very, very, very selfish, because if you were not self-centered, you would think of whether you might possibly be infecting your customers. But of course, they don't care about that. So for them, when they wake up in the morning, look at their faces in the mirror and they look okay and they feel fine, they don't care about anything else. They go out the door, no masks, because they feel fine. So I always tell them, you don't know where I'm coming from. You don't know where I work. You don't know who I've been in a meeting with. You don't know who I've been around. And I'm walking into your store, and there's 20 of us, 30 of us an hour walking into your shop. How about thinking of protecting yourself? If you don't care about protecting me, do you care about your own self? So this is, I think that the thinking has to change, because like Pastor said, it seems as if they are waiting to see someone coming into the store with mucus running down their face and red eyes and scratching themselves and coughing.
Right.
So that they are convinced that, oh my God, this is a potential COVID-19 person. Unfortunately, we do not see many quote unquote success stories, because every story that you hear is of somebody who has died. And in case we don't know, dead people can't speak. And so we are it. And so when people go about pretending that because they don't look sick, they're okay and nobody knows, and so then they can let down their guard, because after all, they said when you have it, you have a little bit of immunity for 90 days. So within those 90 days, they can just go rambo. This is not true.
Okay.
If you're looking for the face of COVID, I have news for you. It's not in the grave anymore. It's not me. It's you. Look in the mirror, because we're all potentially walking around positive and don't even know it.
Let me move on to Dr. Duedu.
The fastest growing number. Dr. Duedu will speak to all of that, but I have news for you. The dead people are not going to be here telling us what to do.
Right. Dr. Duedu, now let me quickly move on to Dr. Duedu and find out from you, Doc.
Right.
You are head of a testing center. Tell us, how bad is the situation currently in the vicinity in which you operate? Who to be specific? What is the real situation when it comes to the COVID-19 numbers you're seeing? How are they impacting the community?
Thank you very much, and good morning to your viewers. The situation is not getting better. Just to put it literally. Day in, day out, the numbers increase. Sometimes it feels a bit scary when you are getting ready to send out results. And the kind of effect it has, sometimes you are looking at it and you yourself get scared. And I think a couple of weeks ago when I had a cold, I will end up having to test multiple times, because I get a cold, I take a few things, it's not going, I test it's negative, and I'm like, am I still incubating? Is it going to come? Because the environment, I know there are many cases, and the cases are not stopping. And so all the time, there are code boxes coming in, contact, suspects, and this is not getting better.
So looking at the situation currently, there also is the problem of people self-medicating. That has become very common now. People start seeing some signs and immediately, especially if they've been told by a friend who has got COVID that this is what to take, then they start taking that. Recently, the director of the GIDC, the Infectious Diseases Center, came out to say that that's a very dangerous trend. You don't need to self-medicate, test, know for certain, and then you can move forward with, treatment. How much of a difficulty is this? People self-medicating and maybe not even coming to test?
So this is a really big issue. And most of the time when people come in to test and you have an interaction, they always tell you that I'm already on medication, I'm already protecting myself and all that. People talk about all kinds of things that they are doing, from the steaming in the neem trees and putting stuff in the nose and just basically doing everything, constantly being on vitamin C and zinc, which sometimes I'm also a culprit of it. But a lot of times, most people are on self-medication. And I think one of the things we fail to recognize is that all these drugs and others are toxins to our bodies. And at the end of the day, it's our liver, our kidneys, which are responsible to clear all of these. So whilst we are on all these medications, eventually, these are going to have effects on us. It's going to affect our livers, it's going to affect our kidneys because of the constant pressure we are subjecting them to. Testing is important, not just for COVID, but for any disease. You test before you get onto medications. And the danger is that if we do not test before getting onto medication, we also subject the entire situation and the virus in our environment to mutate, because constantly it's being exposed, either in subdoses and others, and at the end of the day, it will try to mutate to be able to survive, because life is all about survival of the fittest, and it's not only humans who want to survive. The viruses also want to survive. Other pathogens want to survive. So the self-medication is common.
Okay.
People are doing it, but it's not the best.
You're a doctor of orthodox medicine. Now, herbal medicine has come into the picture very forcefully. I was just sharing earlier today how Archbishop Kalenda of Cameroon has been pushing for us to turn to herbal remedies to actually cure COVID-19. Our own Cardinal, Turkson, has also spoken about some people in the Vatican who supposedly were cured by a herbal remedy. Just today in the papers, we read about Herpa mixture. What is your thinking when it comes to herbal remedies? Do they pose these same risks that you've spoken of with regard to self-medicating?
So actually, herbal remedies will pose higher risks. And that is because there hasn't been so much of refining in putting these herbal remedies together. I should also note that herbal remedies are not new to our environment. For years, we have used them. Even if they haven't been scientifically proven to work, there is that empirical evidence. There are many people who can attest to the fact that they work. But then, taking so much of these will pose even much greater risks, because that preparation that you have will contain many toxic elements. And as you take them in, even though you may have one or two things which are active against the agent, these other toxic elements are going to affect you. And so it's very, very important. In as much as it works, or it may work, we also don't have to abuse it, because we stand to get even worse side effects with herbal remedies, even than the orthodox medicines.
Wow. Dr. Duedu painting the picture there very clearly. You ought to be very careful with herbal remedies. They could be even more dangerous. But let me come to Dr. Dodoi now. What would you say is the real psychological impact of COVID-19? Both people we're speaking to this morning, the survivors, appear to have had panic attacks at some point. Inability to sleep, this fear among others stirring up. How much of an impact psychologically does COVID have on a sufferer?
Thank you very much for having me. The challenge we have is that it's not only because of COVID, but any condition that communication about the condition is not clear, we tend to panic about it. And then there's this also that history knows that when people don't understand anything, they would ascribe spirituality to it. So some people, and in Ghana, we are very religious. So some people will think that, oh, because I have sinned, because God is not happy with me, that is why I'm getting this infection. But the challenge is that, these are infections, these are things that happen. And we don't necessarily have a treatment for it though. But we know that majority of people who get infected do not die. And a lot more people do not even have symptoms at all. So if we are able to preach this message about the fact that the COVID-19 is not like a death penalty, and that we can treat it, and early intervention is important. So that understanding that, in fact, this condition is not as bad as it appears. Yeah, that can lift people's, fears and all that.
Okay.
True, for you to be told of a condition you don't know much about, like if you take the history of, the history of HIV. Initially, we were only showing people who were vomiting and emaciated and all that. But now, the attitude towards people who have HIV has really decreased. So anxiety, yes. And in fact, if you don't have any anxiety, you die early. So there's a bit of anxiety necessary for us to be able to perform. So there's a bit of anxiety which is necessary for you to seek healthcare because you are not well. So, but when the anxiety moves, when the scare moves to where it paralyzes you, that it affects your work. In these two instances, their relationship with their family, whether to go close them is love, or to go or to get away from them is the love you are showing them. So that becomes a challenge for everybody. Okay. So it's important we educate on the condition and the fact that it is not necessarily life-threatening for everyone who gets it. Okay. Let me once we get across that communication phase, then we'll be able to take away a lot of the anxiety, and then the danger that the priest was putting about to start medication before your test is positive. If you have symptoms suggestive of COVID, please see a doctor and let's assess you and diagnose. The challenge with taking medication or taking self-medication is that the drugs themselves do not treat the virus. The drug does not kill the virus. It does not remove the virus. It only improves your ability to fight the virus. So as Pamela was saying, Dr. Mbodu was saying, if we keep on abusing these drugs, especially the antibiotics, very soon that same drug will not work for the conditions they have been known over the years to work for. Okay, Doc, I have to interrupt. When we get into that, right? That means that we are going to have to get new molecules, get new antibiotics that can actually treat other conditions, and that will be a disastrous situation. The very high costs. Right. Let me just take a pause here. We have a caller on the line, and you can call the number on your screens. Na Amanua from Kwabenya. Na, welcome on the show. Thank you for joining us.
Oh, hello. Good morning, Ben. I hope you're well.
I'm very well. Hope you are too.
Yes.
What's your COVID story?
Well, my COVID story is this. Just a week ago, I started having headaches and neckache, and not down with like flu symptoms, I could say. And so I thought, oh, let me go. I went. They told me 12 hours. I said, okay.
Hello, now. Are you still on the line? Hello. Oh, it appears we have lost Na Amanua, who is just about to share her story. But let me quickly come to Dr. Dodoi. Let me return to you. Okay, so Na is back on the line. Na, please go ahead.
Yes. So, so I was diagnosed with typhoid, which was the following day. Yes, but no malaria symptoms. And then after 12 hours, I got my results to say I was positive. Now, that threw me back a bit because I don't know what COVID symptoms are. You hear about this. It's different with everybody. I'm fine. I'm okay. But then it's this neck ache and the headache that was bothering me. As far as I'm concerned, I have typhoid. But I don't know about the COVID. And that is also a bit confusing for me.
Wow. So as of now, you're not certain you have COVID-19?
I know. I am not very sure, but I'm waiting. I'm in isolation. I am waiting after the end of the second week, and I'll go and test again to see what I have. Because I haven't been down. I'm not like lying there helplessly. I am fine. It's just at the moment I've been on antibiotics. I've done all the things. I'm on all the vitamins. The only thing is it's knocked me back for appetite. I can't smell. I can't eat. I'm forcing liquid down me, but I don't feel for food at all. At all.
Wow, you've lost your appetite, and it's terrible. Now, do you mind sharing with us, how old are you?
I'm 71.
71?
Yes.
Right.
But a strong one at that.
I can tell from your voice. So you are in isolation then, or at least you're quarantining?
I am in my house, and I haven't even been outside my sitting room, even to play with my dogs or do anything like that. I'm just inside, yes. And so, I've stopped my grandchildren coming. I've stopped everybody that comes, and with this.
To wrap up, so what is the next move for you?
Well, the next move for me is to do the next test and see what's going on with me, and then hopefully I can find some kind of treatment for this typhoid, because I got this typhoid actually last year from the hotel we stayed in, during the COVID when it first started. Yes,
right.
And mentally I am strong. I try to work my mind not to be so scared. Especially, and I'm asthmatic as well. But I work myself and think positive and move on.
Now, thank you very much for sharing your story. Let me come back to Dr. Dodoi very briefly. Now, the psychological impact could people, and I'll just have you note this question because we have a caller on the line. Can it determine whether you heal or you heal quicker or even pass on? How you approach COVID-19 psychologically. I'll come to you on that right after this call. Papa in Lashibi also joins us. Papa, thank you. Good morning.
Thank you very much. We are all following your protocol. Let's say we are putting on our nose masks and things like that. But the government is not helping matters. 1 week now, the tap is not running. So how do we observe the washing of hands with running water? That's the question. You understand me?
Sure.
Yeah.
Grave concern there being shared by Papa from Lashibi. Sam Enla also joins the conversation. Sam, what is your COVID experience?
Okay, so back in June last year, somewhere mid of June, I went for a wedding. I was actually an MC at the wedding. So I returned home, and on Sunday, my wife being pregnant, she had a temperature.
Wow.
So we thought it was just pregnancy temperature. But early 1 a.m. Monday morning, I realized the temperature has gone to 39. We spoke to the midwife, and the midwife advised that she believed it was an infection. So we had to go to the hospital. So I remember rushing her to the hospital, right? And she was put on drips to regularize the temperature. They actually said it was a yeast infection, blah, blah, blah. But I realized she had anosmia, that she couldn't smell. And I didn't want to scare her because I knew it was something COVID, right? And The next day, we returned from the hospital, I think, on Tuesday. Yeah, but she did a COVID test on Monday, right? And I started feeling cold, which is not normal. So I was bathing hot water, and I had flu. The flu went yellow, thick yellow. So I know when I get flu, and when 5 days is gone. But I realized it was still there, right? So I got on longevity N-Fuse, and I started taking amoxiclav to help clear the flu. The results came 3 weeks later.
Wow.
Yes. And you know when the results came, we're going to do a scan. So as soon as we got to the destination, she had a call that she's positive. So I just had to calm her down. We went to check, and the baby was fine. You get it? So for me, no matter what you do, just boost your immune system, honestly, because our system is not designed in a way to social distance. Familiarity breeds contempt. So you will not even wear your mask when you meet a family member or a friend. It's like that. So for me, I believe let's all boost our immune system.
Right.
Honestly.
Now, Papa and Sam, thank you so much for sharing your experiences. Moving, touching. Let me come to Dr. Dodoi very quickly on these two matters so we can get to wrap up with what the way forward is. I was talking to you about what these psychological matters could have, the impact. Could it affect healing? Could it even impact whether someone makes it or not? And quickly as well, I want you to attach, it appears a lot of people are getting COVID, but they are in denial. Why is that?
Yeah. Okay, so let me start from the last one. I mean, denial is a normal human response to any bad news, anything. So your partner is dead, your parent is dead. Initially, you want to believe probably there was something wrong, somebody didn't check something, but that makes you feel good that no, probably there's something, it's not my fault, it's not, I mean, you want to reverse. So it's actually a wishful thinking which come out, I mean, really. So, and that's a normal response. So, some people can respond with getting angry. People can respond in any way. And then, so these are how we respond to things that threaten our very livelihoods. So, I mean, when you get bad news, you want to find out, am I going to survive this and all that? Unfortunately, and very unfortunately, when people are anxious and have anxiety challenges, the body produces hormones that will decrease your immunity. So, in fact, if we don't psychologically prepare people when we are testing them, when we are advising them on treatment and all that, if we don't kind of prepare them psychologically, they are, I mean, non-preparation is going to decrease their immunity, and they are more likely to calm down under COVID. They are more likely to fall or get sicker. They are more likely to, if you get sicker, you're more likely to lose your life. So it's very important we understand. And I think I would also want to probably advise my colleagues, doctors. In fact, I've heard this is not the first time I'm hearing of typhoid being misdiagnosed for, I mean, a COVID. It's just, so let's do our job well. Let's make the correct diagnosis and let's treat people.
When you say let's do our job well, are you suggesting some doctors are not doing the work well?
And secondly, the caller also mentioned about amoxiclav, which is an antibiotic, which has got nothing to do, I mean, with a viral infection. It is given if after the viral, we suspect you have an imposed bacterial infection, then we can go in for the antibiotics.
So very quickly, Doc.
You can see there's a lot of misinformation going around. There's a lot of loose ends. People are not sure of what is happening, and they're getting pieces of advice from everywhere. Unfortunately, some of them
So you feel some doctors are misdiagnosing?
This kind of exaggerates and, I mean, amplify the fears that people have, that one doctor says this, another doctor is saying that. So it is very important my colleagues come on board, and then we do proper assessment, and then people should know that every condition, we take a history, we examine before we give treatment. So self-medication really is not good. And people must understand also that these things are the fact that you want to protect us, or it should be more. It's something that should make you want to pay more. That's yes, if I have it, it is better I isolate it, better I do all that than to get others involved. Okay. But the self-denial and the denial stuff will sometimes kind of like paralyze you, and you will not be able to. And again, Maria mentioned about she telling people to wash their hands and wear their mask and all. Yes, that tells you that these things are not foolproof. I mean, all that we are asking people to do is to say that they will decrease the likelihood of getting the infection. There's social distancing, hand washing, each of them would decrease your likelihood of getting infection. Okay. So when you put all the three together, then it makes it, less and less likely to get the infection. But that does not mean. Let me come to Dr. Duedu at this point in time. So if you can hear me, Dr. Duedu. So we'll be wrapping up with Maria and Shadrach shortly. But Dr. Duedu, I just want to run this quickly by you. Do you also agree that some doctors may be misdiagnosing when it comes to COVID? Because some are saying it's malaria, some are saying it's typhoid and all of that. Is there misdiagnosis in there?
So it's probably a yes and no. A yes in the sense that when you take malaria, for example, sometimes we don't wait for a test. And for the fact that the person is showing symptoms which you are so familiar with, it is instantly diagnosed as malaria. And we have similar situations for other diseases. No, in the sense that sometimes there's actually a co-infection or a mixed infection. So we have had instances where people have gone in, have tested positive for malaria or tested positive for another disease, and then they also have COVID. So it's important we have that differential being done, and that is something which at the moment is lacking in most of our facilities, whereby differential diagnosis is not routinely done properly. So it's important that if a person has more than one infection, you diagnose, you are aware that the person has more than one infection. Okay. And then you can met out the right treatment. So we have those two situations, the mixed infections and then the diagnosis, which is just based on assessment of what somebody is telling you. That definitely is wrong. So
Shadrach and Maria, to wrap up. Shadrach, what would you say is the foremost lesson you've learned from getting COVID-19? Now you're a COVID ambassador. What is the lesson you've learned?
COVID ambassador, indeed. Well, I think that before I answer that, let me.
Shadrach, unfortunately, we don't have enough time for a prelude. So please, if you could go straight to the answer.
We had 9 days of testing. We have tested about 9 days. The results have not come. So the doctors saw the symptoms and they thought that we have to start the medication. So it wasn't self-medication. That's just that, by the way. I think that the lesson I have learned most is that people are unknowingly killing their neighbors by infecting them with COVID. Because if you are positive and you are not aware, you have not even tested, you are not showing symptoms, and you get somebody infected, and this person dies, sometimes you don't even know that you got the person infected. And then you kill this person because in ICU at Kolebu, a patient that I was sharing the ward with died. And the question that came in my mind was, is the person who infected this man even aware that he got this man infected? And is he aware that his negligence or probably whatever he did to infect this man has caused the life of this person and his family?
So the lesson in there would be?
The lesson is that, and I'm picking it from Ephesians chapter 5, verse 15 to 17. The Bible says that we should be wise, because, if you allow me, let me quickly read that. And this is what the Bible says. It says that, see that you walk circumspectly, not as fools, but as wise, redeeming the time, because the days are evil. Therefore, do not be unwise, but understand what the will of the Lord is. People should just understand that we are not in normal times. This is not a time to celebrate birthdays and enjoy yourself with certain things. That will lead to the infection of somebody.
Maria, we'll wrap up with you on your lesson. Thank you, Shadrach. Maria, so what would you say is the foremost lesson you've learned from this that you would leave Ghanaians with?
Sorry, my turn, right?
Yes.
Okay.
So,
yes.
Your experience, what is the foremost lesson you can share with Ghanaians?
Right. For me, the biggest takeaway from all of this is the fact that our efforts are not in isolation. They will not work in isolation. We have to work in tandem. And until you see other people's lives as worthy as your own, then you will not assign the same amount of value to protecting them as you do to protecting yourself. And unfortunately, it's not necessarily going to result in harm happening to them and then you going scot-free. Because guess what? By not protecting somebody else, you're increasing your own risk. You're increasing the risk of people that you love. And we require discipline and a concerted effort to make this thing work.
Okay.
This is my biggest takeaway.
Thank you so much, all of you. Maria Jura is Director of Public Affairs, University of Health and Allied Sciences. We're also joined by Dr. Dodoy, who actually Dr. Eugene Dodoy, who happens to be Head of Psychological Medicine and Mental Health Department, School of Medicine, University of Health and Allied Sciences. We had Dr. Duedu as well, who is head of the COVID-19 Testing Center at the University of Health and Allied Sciences, and Shadrach Opong, a COVID-19 survivor as well. Lady, gentlemen, thank you so much, and we wish you, Shadrach and Maria, the very best. Do stay with us. There's more coming up on the AM show. We talk the election petition and more. Do stay.